Good morning, Dr. James. We would like to ask some questions regarding the medical applications of electromagnetic radiation.
Good morning.
So, the first question is, what have this electromagnetic radiation donated to the medical applications?
There are many uses of radiation. The most well-known is X-rays to see where the bones are broken. The broad area of X-rays used is called radiology. Within radiology, we find more specialized areas like mammography, computerized tomography, and nuclear medicine. These are for treatment of disease or cancer and are commonly called therapy. A subspecialty in nuclear medicine is nuclear medicine therapy. A common example of nuclear medicine therapy is the use of radioactive iodine to treat thyroid problems, including thyroid cancer.
So, can you tell me more detail about X-ray?
An X-ray is a common imaging test that has been used for decades. It can help your body without having to make an incision. This can help them diagnose, monitor, and treat many medical conditions. Different types of X-rays are used for different purposes. For example, your doctor may order a mammogram to examine your breast, or they may order an X-ray with a barium enema to get a closer look at your gastrointestinal tract.
Next, can you explain to us about radio waves?
Radio waves is an electromagnetic waves with radio frequency. It is used to send signals through the air without using wires. In medical application, radio waves is used to transmit the patterns of patient's heartbeat. Next, radio waves sending a signal which is used by the paramedics to allocate patient's house and also to radio conditions of the patients. This is to ensure the paramedics can prepare the treatment kit. Radio waves is important in medical field which is used in MRI scanner. MRI is a scanner to produce image of soft tissues, fluids, fats, and bones in human's body. It is also used to diagnose many problems and one of them is to identify tumor.
Next, can you explain the application of microwave, infrared, visible light, and UV radiation in medicine?
Microwave is used for heat therapy. It will relieve pain, warm the blood, increase blood flow, and reduce muscle stiffness. Fats, water, and sugar in the body will absorb the microwave and change it to heat. Infrared radiation is used in pulse oximeter. Pulse oximeter is a medical device that indirectly monitors the oxygen saturation of a patient's blood. It also measures the change of blood volume in the skin and will produce a photoplethysmogram. Visible light radiation is used in endoscopy. Endoscopy is a non-surgical procedure used to examine a person's digestive tract using an endoscope. It is flexible and small. It works by bouncing light along the walls of the cable and to the patient's body. UV radiation is used in treating patients that suffer from psoriasis. Psoriasis is a skin disorder that causes the skin cells to multiply 10 times faster than normal. UV radiation penetrates the skin and slows down the growth of affected skin.
Lastly, can you tell me what are the cons of this radiation?
Radiation can damage living tissue by changing cellular structure and damaging organisms' DNA. The amount of damage depends on the number of variables, including the type and quantity of radiation absorbed and its energy. Because radiation damage is done at cellular level, the effect minor or even moderate exposure may be difficult to detect and often can be successfully repaired by the body. However, certain types of cells are more sensitive to radiation damage than others, and with great exposures, cellular recovery might be less successful and turn cancerous. Radiation can kill cells outright, as well as damaging their DNA. This obviously creates a hazard, but also opportunities for medical intervention if cellular death can be precisely targeted, for example, in radiation therapy for cancer. Much of our knowledge of the risk of radiation is based on studies of survivors from atomic bomb at Hiroshima and Nagasaki in Japan at the end of Second World War. Other studies of radiation of industry workers and people receiving high doses of medical radiation have added to our understanding.
Okay, that's all for today. Thank you, Dr. James, for your willingness to spend your time for this interview. We really appreciate it.
My pleasure.
Hi and good morning, Doctor. I'm Sarah, student of Program Pengajian Pra-University.
Oh, hello and good morning.
If you don't mind, may I ask you a little bit about how does doctor examine a cancer patient? As we all know, Cancer patients will know that they have cancer after the doctor had diagnosed them and told them about all the details regarding their cancer, such as what stage of the cancer that they're having, further health appointments and treatments. So basically, what are the methods used by the doctor to determine the cancer cells in the patient's body?
First, we will do a diagnosis on the patient. If you have a symptom or your screening test result suggests cancer, we will find out whether it is due to cancer or some other cause. We may ask about your personal and family medical history and do a physical exam. We also may order lab tests and then scans such as using the magnetic resonance imaging, MRI, or other tests or procedure. This imaging procedure creates pictures of areas inside your body that helps the doctor see whether a tumor is present.
What kind of lab tests are being carried out?
A high or low levels of certain substances in your body can be a sign of cancer. So, lab tests of the blood, urine, or other body fluids that measure these substances can help us make a diagnosis. However, abnormal lab results are not a sure sign of cancer. Lab tests are an important tool, but we cannot rely on them alone to diagnose cancer. Then after that, we will use the scan to find out more. MRI plays an important role in cancer diagnosis, staging, and treatment planning. With MRI, we may distinguish between normal and mutated tissues to precisely pinpoint cancerous cells within the body. It also may be useful for revealing metastases. MRI provides greater contrast within the soft tissues of the body than a CT scan. As a result, it is often used for imaging the brain, spine, muscle, connective tissue, and the inside of the bone.
Oh, now I know. Alright, thank you doctor for all this useful information and for your time.
Okay, sure, no problem.